I think precision medicine is truly an important area. It's clear from the last decades that we don't have enough information about the patient. We treat everybody more or less the same, so to speak. And so getting more information means stratifying and having treatments that are very precise and meant for this group of patient or the single patient, whereas up to now we haven't done that. We try to implement precision is by analyzing cells, not as a mixture of cells, but at individual cells, where we can identify and characterize in very high molecular detail whether the cells in, let's say, a tissue are the same or whether they have different functions within that population of cells, by really pinpointing very precisely what the molecular determinants are, and from that we can get a function. For translation, what comes to mind is a series of experiments that we have published already, where on the basis of the molecular analysis of blood and the differentiation of monocytes to macrophages, we've noticed a way of overcoming tolerance, the non-responsiveness of cells, by giving it a very simple compound, which is a sugar, and that sugar reverts in part the non-responsiveness of the immune cell. So basically that stems out of the molecular analysis, but is a clear case of now we know how to tackle it. We have not very precise information, but enough to now say, if we take this sugar and we would treat a patient with sepsis, we would expect that this would have a positive effect. So it's a direct translation of basic research into a potentially translatable and clinically applicable method. I think the medical field will become very much computerized because the number of parameters that you will need to know in the future in order to determine what the state of a cell or an organ is will very much depend on enormous data that is available or that has to become available in order to translate. And the doctor, instead of looking at some symptoms, will look at the genetic code, the epigenetic code, the metabolome, whatever, and based on that, will have to make a decision. But he cannot do that without us or the field or the bioinformatic people to analyze that data and to make it ready for a relative outsider to translate it into a treatment. So it will change dramatically, in my view. It's difficult to say, but a lot of it will replace a doctor looking at something, looking at my foot and say, it is bruised. Yes, I know. That you cannot do in a computer, or maybe you can. But then the patient has to add that information. So, no, I think that the doctor will always be important, but his work will shift enormously from simply observing to using an enormous amount of data in order to make the right decision. And certainly precision medicine means per patient, right? And that will be a whole new area.